Hypothenar Hammer syndrome is a fascinating yet often overlooked condition that can have significant implications for those who engage in repetitive activities involving the ulnar side of the hand. It's a vascular condition that arises from trauma to the ulnar artery, typically due to repetitive blunt trauma to the hypothenar eminence, which is the fleshy part of the palm on the ulnar side, where the little finger resides. This syndrome is particularly common among individuals who perform tasks that require a strong grip or repetitive motions, such as carpenters, mechanics, or even musicians who play certain instruments. The pathophysiology of Hypothenar Hammer syndrome revolves around the ulnar artery, which runs along the ulnar side of the forearm and into the hand. The ulnar artery is responsible for supplying blood to the little finger and part of the ring finger, as well as the hypothenar muscles. When a person experiences repeated trauma to the hypothenar region, it can lead to a condition known as thrombosis, where a blood clot forms within the ulnar artery. This clot can obstruct blood flow, leading to ischemia, which is a deficiency of blood supply to the tissues. Patients with Hypothenar Hammer syndrome often present with a range of symptoms that can be quite subtle at first. They may notice coldness or numbness in the little and ring fingers, particularly after engaging in activities that involve gripping or striking with the hand. There may also be a sensation of tingling or a feeling of heaviness in the affected fingers. Over time, as the condition progresses, patients might experience more pronounced symptoms, such as pain, discoloration of the skin, or even ulceration in severe cases. The symptoms can be exacerbated by exposure to cold, as the compromised blood flow can lead to a more pronounced response to temperature changes. Diagnosis of Hypothenar Hammer syndrome can be challenging, especially in the early stages when symptoms may be vague. A thorough history is crucial. Understanding the patient's occupation and any repetitive activities they engage in can provide valuable clues. Physical examination may reveal diminished pulses in the ulnar artery or changes in skin temperature and color. However, imaging studies are often necessary to confirm the diagnosis. Doppler ultrasound can be particularly useful in assessing blood flow in the ulnar artery, while angiography may be employed to visualize any occlusions or abnormalities in the vascular structure. Once diagnosed, the management of Hypothenar Hammer syndrome can vary depending on the severity of the condition. In mild cases, conservative treatment may be sufficient. This can include rest, activity modification, and the use of splints to immobilize the hand and reduce further trauma to the hypothenar region. Physical therapy may also be beneficial in strengthening the hand and improving overall function. However, in cases where there is significant vascular compromise or persistent symptoms despite conservative measures, surgical intervention may be warranted. Surgical options can include thrombectomy to remove the clot, or in more severe cases, bypass surgery to restore blood flow to the affected fingers. The choice of surgical technique will depend on the extent of the vascular damage and the overall health of the patient. It's also important to consider the long-term implications of Hypothenar Hammer syndrome. Patients who have experienced this condition may be at increased risk for developing chronic pain or functional limitations in the hand. Therefore, a multidisciplinary approach involving hand therapists, pain management specialists, and orthopedic surgeons can be beneficial in optimizing recovery and ensuring the best possible outcomes for patients. Education plays a crucial role in the prevention of Hypothenar Hammer syndrome. Individuals in high-risk occupations should be made aware of the potential for this condition and encouraged to take preventive measures. Ergonomic tools that reduce the impact on the hypothenar region, as well as proper techniques for gripping and handling tools, can help mitigate the risk of developing this syndrome. Additionally, regular breaks and exercises to improve blood circulation in the hands can be beneficial for those engaged in repetitive tasks. In summary, Hypothenar Hammer syndrome is a condition that highlights the intricate relationship between our activities and our anatomy. It serves as a reminder of the importance of understanding the potential consequences of repetitive trauma, especially in the context of our daily lives and professions. For residents and young surgeons, recognizing the signs and symptoms of this syndrome, along with its underlying mechanisms, is essential for providing comprehensive care to patients. As we continue to advance our knowledge in orthopedics and trauma, it is vital to remain vigilant about conditions like Hypothenar Hammer Syndrome. By fostering a deeper understanding of the condition, we can not only improve diagnosis and treatment, but also contribute to the prevention of this syndrome in at-risk populations. Ultimately, the goal is to enhance the quality of life for those affected and ensure that they can continue to engage in the activities they love without the burden of pain or dysfunction. In conclusion, Hypothenar Hammer Syndrome is more than just a clinical diagnosis. It is a testament to the resilience of the human body and the importance of protecting our musculoskeletal health. As we delve deeper into the complexities of this condition, let us remain committed to educating ourselves and our patients, ensuring that we are equipped to address the challenges that arise in the realm of orthopedics and trauma.